We're glad to have you back. Now, the future of health tech innovation and diversification in Africa is bright, driven by technological advancements like AI-powered diagnostics and telemedicine, and also a growing focus on localized, accessible solutions. Now, key to this future is a supportive ecosystem with funding, strong government partnerships, and robust regulatory frameworks. Diversification will come through expanding on areas like supply chain management, mobile health, and data analytics to leapfrog long-standing healthcare challenges across the continent. My guest is Mr. John Itodo. He's a data-driven strategist, and he joins me live from Leeds in the United Kingdom. Thank you so much, Mr. Itodo. It's really good to have you on the show.
Thank you very much, Tolu. I'm glad to be here.
All right, then. Now, recent reports shows that Africa's digital health market could exceed $40 billion by 2030. My question really would be, what's fueling this rapid growth, and where do you see the biggest opportunities?
Well, first of all, I would just like to say that for that figure, I'm not really sure, because when I was looking deeper into it, I saw different contrasting figures. But one thing is certain, that we are currently in the billion range valuation, and definitely there is growth in this sector. And by 2030, that figure will definitely grow. Now, the question you put to me was, what is fueling this? First of all, I would like to say the first thing is the need. Because in Africa as a whole, the need for medical care is very, the accessibility to medical care is very slim. And I was looking at a report by the National Association of Resident Doctors earlier this month, and then they put the figure per patient ratio for a doctor at 1% to 9,000, whereas the World Health Organization has put the ideal figure for 1 ratio 1,000. So you can see the disparity. Another thing is also the advent of technological advancement. Now we are in the era of AI, and a lot of these advancements are being made, because everyday problems are being produced, and solutions, tech-driven solutions, are there to solve these problems. Also, another major thing is the availability of other telecommunications. You know, as of 2023, over 84% or more of Africans have access to mobile phones. And recently, I also saw that Starlink and other, multinational companies are also coming into Africa to come and put in investment. So you see, these are drivers. These are things that are making it, making the solutions for this problem to be solved.
Despite this growth, you just mentioned that over 50% of Africans still lack access to essential healthcare. Now, so let me ask you directly that how can technology help to close this gap sustainably?
Well, the accessibility to Medicare, this is general. It's all over the world. But the thing is, when you begin to look at how some other climes are juggling this, trying to find solution to these problems, as opposed to other climes, then you can see what solutions is being brought in by technology. So there are areas I will point out that technology can solve is in the value chain. In fact, in all areas of the medical value chain, there is a tech solution to simplify it and make it readily accessible to the general public. There's one company, Zipline, who are actually employing the technology of robotics, drones, to deliver medical supplies to various parts that are not readily accessible, to get their medical supplies, either be it blood, all medical paraphernalia being supplied, on time. Areas of say EMR, electronic medical record. This is another area in which solutions can be made, because before solutions can be gotten, you need data, and you need to capture data properly. Without having a seamless and a seamless solution, be in the form of electronic medical record systems, you can't capture all this data and store it safely. In some climes in Africa, we are seeing that people are still keeping files paper-based, in this current generation that we are in, which is leaving it prone to damage. Areas of also, as you mentioned in the introductory speech, telemedicine. This is another area in which solutions can also in areas of solutions can help. Again, I mentioned earlier that the ratio to 1 to 9,000. Imagine a doctor sitting down, to see 9,000 patients. When you have telemedicine, this makes it seamless. Because before it comes to the doctor's table, they would have done what they call medical triage. And some of all these things will fizzle out in the pipeline. And it will be the most serious cases, the most severe cases, the cases that actually need to be seen by the doctor, that will eventually need to be seen. And those other less serious cases will be solutions will be found for them along the line. And one other thing I would like to also put into as an analogy, if you look at the banking sector many donkey years back, I can remember then when I was small, I used to follow my dad into the bank. You will see large queues, but now you see ERC having a POS machine, that can serve the locality where they stay. This can also be implemented in the medical sphere, because we have chemists, we have pharmacists, taking the load off the primary healthcare, doing the work of the primary healthcare system, taking the load off the major and general hospitals, making sure, because this I would like to call them hubs, are readily available, and they are, I like to call them last mile, because you can come out from the comfort of your home and enter these places easily. This is an avenue for partnership to take the load off the central and disperse it, across board, so that we are having footfall into the hospitals of only cases that are very severe, cases that are severe and need specialist treatment.
Great stuff there. So you just talked about financial inclusion there. So should we call this medical inclusion then? That's what it looks like. But when we talk about...
Yes.
When we talk about diversification in health tech, what does it actually look like? And how are African innovators approaching it differently?
Well, to me, diversification in healthcare, looking at the current solutions that you have for a particular problem, and looking at how that current solution can solve other problems. I will say, for instance, now, all being put in the value chain, or in the health value chain. Say for one of the the solutions or companies that are doing something wonderful are, I would like to say Life Bank, because they are not only they are not only looking, they are in the value chain of logistics, but they are not just only looking to one aspect of health delivery of medical paraphernalia or medical equipment. They are also in areas of blood, and other things. You can just imagine your loved one, needing healthcare, and they need to carry out a serious operation, and then you hear that there's lack of oxygen. Look at it. Look at our road networks that we have back home in Africa. With if these organizations are also diversifying those technologies into aerial technologies that I mentioned earlier,
drones and all.
It makes it a lot more easier, for people to get this healthcare solution. And also this medical inclusiveness, as you fondly mentioned, is also another way, because you are if we have those solutions readily available, healthcare can be taken to the grassroots, because this, the mechanisms are already in place. So government don't need too much. They don't need too much. Infrastructure now. They just need to empower the ones that are already on ground.
Indeed.
And one major technology that I forgot to mention that is not in place, especially is scarce, is medical triage. Medical triage, what we have as 911 or 999. I'm not saying about the call now. I'm talking about the triage aspect of it. I'm talking about the lines. I'm talking about the triage aspect of it. If we are able to assess medical conditions, triaging it and stratifying it into the severity. And again, as I mentioned, passing down most of these solutions to the grassroots sector and leaving the more severe ones to the general hospital, to the central. This is a way. This is another way of diversification. And it will help a lot, because the need is there.
Oh, all right. Let me follow up and ask you that our local startups and entrepreneurs are transforming this healthcare delivery in ways that large institutions might not be able to do.
Well, the word is last mile, because they are in the grassroots. These are the people that are innovators. What are innovators? I would just like to say these are people who are within a locality, found a solution, a problem in a locality, and they are finding solutions within that locality. When they've solved that problem within the locality, they take it up scale. And what is the major thing that they have? The grassroots. They have solved they know, they have the knowledge, of the problem within the grassroots. So these are the things that the central may not be able to see, and that is why they need to empower, by giving out them support to these startups, to these people, businesses, individuals or organizations that are looking to solve problems.
What are the biggest roadblocks holding back our health tech ecosystem now, from infrastructure? I'm a business journalist, funding, and of course, policy support.
Well, first things first, I would say the first problem is data. We need a structured, we need intentional, we need technology in data gathering, again, from the hospital sector. Most of them are gathering data, and they are still using paper-based collection and storage system, which in itself can be prone to damage. Now, when we begin to intentionally employ electric mode of collection of data, we can now easily analyze those data to create insights. From those insights, we can now empower and create intentional policies. What will those policies do? Those policies will now inform the way we spend. Now, talking of spending, the World Health Organization has given that a nation's national budget should have 15% earmarked for medical solutions. I want to ask you this question. What was our budget in Nigeria for 2025?
That's a big one.
So now, you see where I'm going. Because they don't have the right data. Now, if the budgets are put right, you can now focus on infrastructure. You see, you are not channeling your budgets to the right infrastructure, to the right talent, to the right people, to the right organizations, to the right minds who are ready to create these solutions for the betterment of the common people. So I'll just largely put it that, first off, data collection, insights will support our policies. Our policies will also inform our funding, and this funding will also support our infrastructure.
So now,
then seepage to the grassroots to create solutions for them.
Indeed. Now, how can governments, now global partners, of course, investors must always have a space here, collaborate more effectively to scale innovation across borders in Africa?
So this lies, the onus again lies in the hands of the government, because one, if you are not if the enabling environment is not there, the African nation needs to sit down, and come and think. If the enabling environment is not there, you as a business analyst, as a business journalist, would you like to put your money where you know that it's a risky, you won't give you returns? Because we are talking about business people here. So we need to solve our power problems. You see, we need to solve our security problems. We need to solve the problems of also politics and unnecessary bottlenecks, because you will see that when these organizations come in, they are being stifled by certain policies or governmental or call it bottlenecks. That doesn't make it attractive for them to come to invest. Naturally, come on, go on.
Go ahead. No, make your point. Make your point. Let me allow you make your point.
So, all right. So when this, when this is being strengthened, and I'm not saying that that government are not having their own, they are not doing their own bit. I'm seeing need that more visible, now, within the tech space, and the ministry for that houses that parastatal, are doing, by putting that in place, they are also showing concerns. But if these policies are being put in place, it will attract these people. If security is being put in place, it will attract these people. If power is being put in place, it will attract these people.
Interesting stuff. Let's look ahead now. What key steps must be taken to ensure Africa's health sector grows inclusively and now stay competitive globally?
First off, Africa, we don't know what we have. I was reading somewhere that we are rare earth metals. We are the fourth producers in the world, fourth people who are capable of making that production in the world. So eyes are on us. This is the time, with the advent of AI, with the advent of chip making and all that. This is the time for us to milk that to our advantage. We have brains scattered all over the world. We have brains that are ready to come to harness what we have. We have the human capital. We have resources. What more do we need? There are climes, even in the UK or in the Europe, that don't even have as much as we do. But see what they are doing. So just imagine we in Africa are now able to harness what we have by putting policies in place, by making power available, by creating the atmosphere that organizations that can attract investment into the country. So we have it. We have it. We just need to open our eyes to it.
Interesting stuff. I must say it's been a nice chat with you, Mr. John Itodo, data-driven strategist. Hope to have you again on the show soon. Really good to have you.
It will be my pleasure.
Thank you so much. Enjoy the rest of your day.
And you too. Thank you very much.
All right. Cheers there. Well, a lot around the investment space, even in the health tech and all of that. Well, let's